Patty has been doing the work in Detroit, and we've talked over the last couple of weeks a lot about Baltimore. Can you just tell us a little bit about what's happening in Detroit in terms of the healthcare, the COVID-19, and how it's impacting communities there?
Absolutely. Well, as you suggest and know, Detroit has been very hard hit, and we've had strong leadership with our governor as well as the mayor of Detroit. It's helpful to know that in Michigan, the African American population is 13.6%, but also in Michigan, very sadly, 40% of the COVID deaths are African American. So that has raised many questions, to which the governor's response has been, and it will not only be this, but very importantly, she has designated her lieutenant governor, who is an African American man, to lead a group, a coalition actually, that is looking at racial disparity and COVID-19. Because we've done a lot of great data tracking in terms of total numbers, but we haven't necessarily been real clear at this point, and perhaps not many places, if any, in the country, in terms of how that breaks down in terms of races, socioeconomic. We know something about zip code. All of that's broken down, and our website for Michigan, michigan.gov, is wonderful in terms of resources and information. But obviously, in a place like Detroit, many of the same things have been experienced. Early on, 4 weeks ago, we were really dealing with the dilemma of bus drivers being very threatened because they did not have protective equipment, and they were very afraid. And then one person actually did get infected, and it really created a lot of concern and a change in what was happening with bus driving. So we've tried to have very ready responses that had meaning, but to jump into the bigger issue in terms of the governor's task force, they actually have a very ambitious agenda to, within 90 days, have real-time solutions that will be operationalized as they go forward. And that really holds some promise for me, especially as we anticipate there could be a resurge of COVID-19 in the fall. I hope not, as we all do, but we have got to use the time in between to truly prepare and start to put fixes on these major gaps and prioritize well.
Is there something that you think that we should be doing at a policy level, what we should be doing at a community level, and what maybe the health system should be doing in order to address some of the inequities that we've seen in this first wave?
I think that we really need to look at our vehicles of communication. And I think we've done a good job in many respects, because radio and television are probably the most reachable for most people. But we are fooling ourselves if we think that smartphones or computers and websites are the way, because again, we have to think about access and how do people obtain and how can they digest and trust the information that they get. So I would hope that socially we really engage with leaders of various communities who are trusted and help empower them with information so that they can then provide hope as well as commitment from people in diverse populations, so that there can be compliance. Because even when I look at the list of the 4 things that you can do to prevent an infection: wash your hands, keep distance from sick people. Well, how do you do that second one, especially if you in fact are in an apartment with multi-generations, or you don't have food, many, many different compounding factors. So Dr. Cooper, I don't know what you would think about working with leadership in that way.
What would you say to your fellow physicians and those other clinical people in terms of what we might be able to do better at a clinical level, at hospital systems, physicians, to prepare ourselves for this potential next wave that may be coming?
Well, this is a really, really difficult time for people in the health professions, and so many of them are sacrificing a lot at this point in time. A lot of them are away from their families because they don't want to spread infection to their families, but at the same time, they're so committed to the work and to caring for patients that they're willing to do those things. They're willing to put themselves at risk, frankly, because knowing that a lot of hospitals and healthcare systems don't have adequate personal protective equipment at this time. So I think it's kind of the message to my colleagues is I have to be compassionate and empathetic towards them at this point in time. I think people are working under extreme conditions. They're making a lot of sacrifices. I think basically a message of the fact that we are all in this together. We're going to work to help each other. Many of us who don't do hospital-based work may actually step up to begin to do some of that so that our colleagues don't burn out. I think making sure that we work with the leaders, the administrators to procure the equipment that we need is going to be really important. I think that we want to make sure people guard against what happens when they are overly fatigued and stressed, and that sometimes they might end up taking shortcuts on their decisions, or treating certain people differently. Um, but just we need to acknowledge with them and validate, the real dilemmas in which they find themselves. Because, if there's a shortage of treatment or personal equipment, how are they going to decide like which patient gets what and how aggressive they ought to be with some patients versus others? This is a very, very difficult situation. And I think we should just tell them that we're here for them, that we are, in this together, and that we are going to advocate for everything that we need, so we don't put ourselves in the position where we are the ones that have to decide who lives and who dies, because nobody wants that kind of responsibility.
That is the subject for one of our next shows, is to really just talk about some of those ethical considerations. And I know Patty, you've been doing a lot of work in that space as well, just looking at, those kind of issues when the healthcare professionals are put in a position of having to make these difficult decisions with little or no guidance.
Yes. Well, and I want to interject that I'm very proud of Henry Ford Health System in Detroit, because the communication has been at least twice a day, very clear and transparent. But to add to the complexity of healthcare is that yesterday it was announced that because of the very serious budget attack of the caring for this preponderance of COVID-19 patients in Michigan by our system at Henry Ford, as well as the Beaumont Health System, and the two of us have been the most heavily hit, we've had to each furlough 2,500 healthcare workers within our system,
Wow.
effective yesterday. And
Mm.
so the complexity there especially is the fear and the suspicion that arises in that kind of situation. And we have a very collaborative, pretty trusting environment, and yet that starts to get very personal. And at this point, I don't know, and it probably wouldn't be appropriate for me to share what kind of position it's important to realize that there are even different kinds of complexities and issues that are on the horizon. And then to anticipate that we might have to prepare for another swoop of this is almost mind-boggling, and yet we can't get into that mindset. We need to be always ready.